There are just so many great opportunities for nephrologists today in caring for patients who have kidney disease and end-stage kidney disease. Patients who have kidney failure are generally some of our sickest patients in the system. They typically have systemic illnesses which eventually affect the kidneys. And as such, these patients have multiple comorbidities. Because of that, we are actively involved in the care of many different facets of the patient, not just their kidney disease. And as such, to me, it's probably one of the more exciting areas in medicine and subspecialty medicine today. There are many challenges in today's environment that affect nephrologists, but also affect a lot of other physicians as well in other specialties. The changing landscape in medicine today is quite challenging for nephrology in particular because our patients are probably the most vulnerable. They're in most need of services, and as such, we interact with so many different facets of the healthcare system, and it's created a big challenge for nephrologists in the care of patients, especially in the outpatient setting. These challenges range from the cost of medications. Our patients on average are taking 11 medications each patient, and the cost of the medications is, as you know, quite significant. The patients cannot afford these medications. We are actively involved with social workers, nurses, family members, in terms of, and other organizations, national organizations, to help patients achieve access to even the medications which are needed to treat not only their kidney disease but also their comorbidities. Challenges of transportation in our patients is a big issue nowadays. This is where I might add the bureaucracy of medicine has affected the care of the dialysis patient, because certain criteria supposedly need to be met for patients to obtain certain transportation to a dialysis facility, which is life-saving. And I think sometimes those who make these decisions that you have to meet or fall into certain categories to obtain transportation to your life-saving therapy, well, patients may not fit into a certain category. I think that there's other challenges in the sense that we serve as the primary care physician for a lot of these patients. We see them 3 times a week, sometimes 4. And what happens is the patients oftentimes are too ill to see other providers. And so we have to try to coordinate the care of their other comorbidities in addition to their end-stage kidney disease problems. We as a group, I think, are quite stretched, or what I say, overworked. And as such, you can see that the amount of physicians who are training in programs, nephrology training programs, has declined over the past several years. 1/2 of the 134 or 135 training programs for nephrology in the United States did not fill this past year. Approximately 1/3 of all the spots that are available in the United States for training kidney specialists were not filled. There are solutions through both the American Society of Nephrology and other organizations to try to fill this void, but you know, it's been this has been going on for now a few years. The last few years in particular. Like I said, I view this as one of the more exciting areas in medicine because we are actively involved in the care of these patients on a daily basis. Our dialysis units begin seeing patients from 6 o'clock in the morning, and they generally close about 11 o'clock at night, and this is 6 days a week. So to me, and for those who have been doing this for a while, these new challenges are evident, but I think that the the future is still something that many of us are looking forward to in coming up with those solutions.